All right, we are live. Hello, everybody. It's Casey again. You might be getting sick of seeing my face because I'm on here all the time now, but I am one of the Nursepreneurs Community and Partnership Specialists. I am here with Shanna Amoroso. Shanna is a board-certified acute care NP, and she is the NP expert lecturer for our current workshop that we have going, which is on PRP, non-surgical vaginal rejuvenation. That is a mouthful. So I wanted to introduce everybody. And if anyone is thinking about enrolling and still has questions, registration is still open. So we thought we'd take this opportunity to just introduce you, and Shanna can answer any questions. But Shanna, if you want to kind of give a little background about yourself as an NP, that would be awesome.
Sure. Hi, everybody. Thank you, Casey. I'm really excited to be, doing this with the Nursepreneurs, and, welcome to everybody who's participating. So I've been a nurse almost 17 years. Most of my background had been critical care, and I've been a acute care nurse practitioner for 10 years now. And over 4 years ago, I got into aesthetics and regenerative medicine. And so still a little bit of per diem critical care, can't give it up.
Can any of us work just one job? No, we never can.
No, it's in nurses' blood.
Yeah,
hence
literally.
nurse.
Exactly.
So then I had this opportunity to kind of make aesthetics and regenerative my more primary role. And so I do a lot of PRP, and one of those, kind of services became vaginal rejuvenation. And so it's been really fun and exciting, and never thought, a few years back, or, that I'd be where I am now doing vaginal rejuvenation.
Yeah. And, okay, so first of all, my background is peds. I don't know if everybody who's familiar with the Nursepreneurs community knows that, but my background is clinical, but I'm in the peds world. So, vaginal rejuvenation, not a thing in the peds world. And honestly, I think, so when we take this from a business owner perspective, I don't know that even, maybe I'm wrong. I don't know that even a lot of NPs or nurse business owners in the adult world, even in the wellness space, even realize that this is a thing that they could be offering as a service. So briefly, Shanna, will you just kind of give like a little background in terms of like why vaginal rejuvenation? What are women coming and what are they saying? And why are they seeking that?
Yeah, absolutely. So something I didn't mention in terms of my background, which I know I talk about a little bit in the actual lecture series, but when I was in graduate school, I was a SANE nurse. So I was a sexual assault nurse examiner. And, obviously part of that training was a lot of pelvic exams. So, most of us in nursing, sure, peds too, but, learning Foley's and some basic female anatomy, unless you're maybe in labor and delivery or, kind of that world. But for the most part, outside of, some pretty basic anatomy, most of us aren't, don't get a ton of training in, extensive female anatomy. So that kind of introduced me to another world, and did, lots of assessments, diagnostic for female anatomy. And then that kind of helped segue into vaginal rejuvenation, which obviously isn't necessary for everybody. But yeah, I think that I was even surprised when I got into it. I had been a nurse for years already and a nurse practitioner. And when the, team that I was working with kind of presented vaginal rejuvenation as a service, we already had the equipment, and it just kind of seemed like a no-brainer. We kind of would giggle about it. And the more I read and, kind of really delved into it, I realized that there's not a lot of options for women. And I see women that, break down in tears often, because they feel like they just don't have options. Even in terms of, when they talk to their OBGYNs. And so then I kind of stopped laughing about it and giggling and realized,
Yeah.
okay, like there's actually something here. And so yeah, now it's grown, and I have become really passionate about it and empowering women, and hearing their stories, and seeing that I can potentially help them. And like I say in the lecture series, like with a lot of things, this isn't always the perfect fix for every woman, but I've seen it work. And
Right.
I have women who come back for additional treatments down the road, and do testimonials. And so that part's been really exciting as a provider. I think obviously for all of us as nurses, we want to help people.
Yeah.
And so, to be able to do that, and again, when there's not a whole lot of other options. So, I think especially if you already have an established office and
Right.
clientele, I think for a lot of people, they'll realize, it could be, a pretty, from a business perspective, easy
Yes.
addition to their services that they're offering.
Yeah, so that's a good segue, because I wanted to bring up, so in terms of, who this the workshop, first of all, might be good for, and just in general, this sort of service line might be good for, you know, I think, and tell me if I'm wrong, but definitely any current business owner, right, who has like a wellness style, like an NP provider who has a wellness clinic, right? Or med spa owners, or even potentially sort of a lot of the IV hydration owners are also starting. If you have, excuse me, often if you have a brick and mortar, they're starting to sort of expand their services as well. We have some even nurses who are concierge nurses who do a lot of sort of specific, like women are their target clientele. So I would imagine that all of those types of niches would be great for the service line.
Absolutely. And I do concierge, like I do Botox parties. So I do
Yeah.
that. And obviously it's, not that men don't, but that's predominantly women. And also the nice piece, I myself am 41. And so, it's a treatment that's more popular, and going to service women more, as they're perimenopausal, menopausal, post, so kind of like where I'm headed. so
Right.
so to be around other women, also kind of starting to experience certain things as well. But yes, so definitely med spa wellness. I will say I don't see a ton of OBGYNs offering it. I do have a couple that will send me patients, and then I know, which we'll talk about in the lecture series, some OBGYNs are still kind of, the verdict is out for them. But they'll typically at least send me a patient and say, give it a shot.
Sure.
So yeah. And I also find, PRP in general and regenerative medicine is starting to really take off. And, I have a building next door, a physician who does a lot of preventative medicine. So, she'll do blood workups, total body MRIs, that kind of thing. And she's looking to bring in PRP. It's a great, PRP in general is great for, kind of when stuff's starting to decline, but maybe before it's
Sure.
really bad, in terms of
Right.
kind of catching it and restoring it to, a more youthful state. So yes. So from a provider standpoint, even nurses can do this treatment. Obviously, state by state, I don't want to
Right. You mean you might need a medical director, just like with IV hydration in most states. If you're an
exactly.
RN, you need a medical director.
Yes. So
Yeah.
RNs, NPs, PAs, obviously physicians. But yeah, and I think, to kind of segue into, you were saying the patient, the right patient candidate. A lot of women don't know about it, and we'll talk about it in the marketing portion of the lecture series of it's a tricky treatment to market and get the word out. It's something that I've even struggled with over the years. The reality of it still can be kind of taboo, or people don't want to talk about sexual health, or the vagina and orgasms, and obviously, I it's improved. People are kind of losing some of that stigma and talking about stuff more, but that's a hurdle. And then PRP can be tricky to market, because it kind of falls into these gray areas in terms of it's not FDA approved, and Google won't allow you to do an ad for it. So that gets tricky as well. And then also just marketing it, to your current patients. You have people who don't necessarily want to hear or see about it. But we have found, alternative ways to kind of get the word out as well. But like I said, definitely, kind of your middle-aged female. The registered trademark term of OSHA, we'll talk about as well, but that is something you have to pay for, but it
Right.
it definitely is directed for a sexual health and, hence orgasm. So helping with sensation. And that's, I would say, predominantly, kind of the patients that are looking for it, but it's also a great treatment for vaginal dryness, helping with that, helping with urinary incontinence. So yeah. And there's new studies and literature coming out pretty frequently on it.
Yeah, and that's big too. But again, yeah, all of those things, and even in the postpartum, I'm somewhere in between. Like I'm not postpartum in quotes anymore because
Right.
my youngest is about to turn 7, but I'm not quite perimenopausal yet either. But you know, anyone who's had babies can probably relate to like urinary incontinence being a thing. And maybe they've done all the Kegels in the world and whatever pelvic floor PT someone told them they should do, and maybe that's not getting better. So that's another realm to enter into where maybe they're not quite in their late 40s or 50s that your clientele. But
Sure.
the other thing I want to ask about and touch about in this is, and certainly no promises, certainly no guarantees, and we don't need to talk like number by number. But Katie Harris and I were talking the other day, just sort of playing with the numbers in our mind, and sort of looking at what's the cost of PRP and what's the cost of what you need to inject PRP, et cetera, versus what we've seen on the market when we did some market research about what the sort of market average cost of this is to the consumer.
Mm-hmm.
And the profit margin that we were calculating is pretty significant for a business owner. Is that
Absolutely.
right? I mean, would you agree with that?
Yes. And so yes, absolutely. You have a little more wiggle room if you're not going like the registered trademark kind of term, which there really isn't necessarily much of a benefit to that.
Right.
And so yes, so then you can play with your price a little bit more. So it definitely comes down to, your PRP centrifuge and how much, it costs from a consumable, standpoint. I know the device I use is a little probably on the pricier end. And my ROI, my return on investment is still about $1,000 per treatment. It takes less than an hour. And there is a lot of variation. I myself as well have seen, and I have some friends that I talk to in different parts of more along the East Coast. But, and so I've seen, people charge, do you not want me to talk numbers?
I mean, you can
Oh, okay.
say what you've seen. Yeah, no, I just didn't want to make, if you were uncomfortable talking specific
Oh
numbers, but
gosh,
no,
no.
whatever you see on the market, you can tell us. Yeah.
Yeah, no, I mean, I can't say I've really seen much less than in the 600s. And I've
In terms of
seen
treatment costs to the consumer.
yes, what
Okay.
the patient pays.
Okay.
And then upwards to 2000, which I personally don't know anyone that charges that much. I charge 1200, and then we'll play with it. Like I have a Valentine's Day promo going on for 9.99 right now. So there's fun ways to promo it throughout the year, but my cost is like around $200. So yeah. So, and it takes, I mean, I block an hour, be more so for like, kind of the answering questions, even if we've
Sure.
already done a consultation, there can be some hand holding, understandably so.
Yeah, that's
Um,
I'm sure an anxiety producing sort of
very much,
moment.
very much. But, so I block an hour. I mean, unless they're a really hard stick, you could do it in a half hour. I mean, especially depending on your device. And so if you look at it that way as well. But yes, it can be an extremely profitable service to offer.
Yeah. Yeah.
And yeah.
Yeah, I mean that's important. We're nurspreneurs. We're talking about business owners and we're talking about sort of expanding services. And there's a ton right now that's out there.
Mhm.
And I think really as a business owner, in any wellness space right now, it's really easy to sort of get shiny object syndrome and like be like, oh, I want to offer this. Oh, I want to offer this. Oh, I want to offer this. And so I think it's good to sort of think it's really important to be able to really look at numbers. And, we're all nurses. And so I think sometimes we get a little weird about looking at numbers because it feels people have weird relationships with money, to be honest. We all do. We all have our weird money baggage that we come from. And we start to feel yucky when we think of the numbers, especially as nurses, because we just want everybody to be happy and we want to fix everybody, all those things. But we're talking about this from a business perspective too. And you have to look at your numbers and really, I mean, in terms of like having to maintain a certain inventory, Shauna, is that a relative, like, do you have to maintain a big inventory? Or do you have concerns about your supplies sort of expiring before you get to treat a patient with them? Is that something that's really a part of this?
No. So honestly, I mean, and I think this really speaks to the treatment as well, and or PRP in general is, we live in a time and where it's, people want to eat clean and
Yeah.
they're using cleaning products and cleaning, you know what I mean?
Yeah. But it's true though. Cleaning products is
Yes,
true.
okay.
Yeah.
And so the beauty of PRP, right? Especially, like I said, I mean, I do aesthetics, I do Botox, I do fill, I do stuff where we're putting foreign substances, in people's bodies, which always cracks me up because I have those patients that eat very clean and they use, but
Mhm.
they're not opposed to their
Right.
injectables. But
Yeah.
PRP is autologous. It's your own blood product being spun down and injected back into your body and essentially kind of tricking or forcing your body to heal itself. So that idea in general is very appealing to people.
Mhm.
And so then from an expiration, I mean, you're going to have your centrifuge, which is your device.
Right.
Depending on what you use for that. I mean, most, either little test tubes or like a syringe that gets like a ACDA anticoagulant added to it. That
Right.
usually has a pretty long shelf life.
Right.
And then you add a little bit of sodium bicarbonate to your final PRP product. But otherwise, I mean, speculums from an expiration, we where I am, I do a lot of PRP, so we order
Mhm.
in bulk. But I know other places who, definitely do much less. And obviously, depending on how you order your PRP collection kits, that would kind of be the only thing. But no, that's definitely the beauty of it, and could help drive down your costs as
Right.
well. And the other thing too is like once you learn aesthetics, because I'm sure some of the people that'll be participating in the lecture series might work in aesthetics already. And there's definitely an art to that, an art
Right.
to putting filler in someone's face or, this is pretty, like you have your injection points. If you can
Right.
draw some blood, like it's pretty, there's not a huge art to it. Let's just say.
Right. Right. We're not talking about like, right. When you're messing with someone's face, you know what I mean? Let's be honest. You could be like, oh, I went too far on the filler there, or,
Right.
Whatever. Whereas this is like, you're just re-injecting. This is just, it's like, it's a shot.
Yeah.
You're kind of giving a shot or, whatever.
I know. And not to downplay, because I know when
Yeah.
I started, it's intimidating. And like I said, I had
Yeah.
experience with, pelvic exams and speculums but it's still intimidating. So, and I appreciate that, kind of overwhelming feeling that people will have. And sure, like anything, there's definitely can be risks but
Of course.
really safe treatment.
Right.
I always
Right.
tell patients, because, one of the most common questions I get asked is like, what is the risks? And, of course, and we'll talk about consent, but what I see and what I tell patients is like the worst thing that I've seen happen is it might not work,
Right.
which
Right.
obviously stinks and is disappointing, but considering all the treatments out there for, and risks and, it's pretty,
Right. Pretty safe.
safe. Yeah.
You sort of half answered this just coincidentally while we were talking, but Lisa, hi Lisa, by the way. Lisa is the best. I know Lisa well. She's watching us.
Hi,
live
Lisa.
right now. But Lisa, and she is a nurse business owner in Georgia. But anyway, Lisa said, what supplies and setup do you need?
Yeah. In Georgia, Lisa? Is that where
she's in Georgia?
Okay, cool. I was in South Carolina for a while in Charleston. So,
Awesome.
but a Jersey girl, I had to come back up north. So,
Yeah,
but okay. Oh, supplies. So we definitely do talk about this in the second part of the lecture series, but other than whatever you need for your centrifuge and PRP, you need 3 cc syringes. So you'll need a couple of those. You need, oh my gosh, I'm blanking. Okay. You need 30 gauge 1/2 inch needles, 27 gauge 1.5 inch needles. So your syringes and your needles, that covers that. Sodium bicarbonate. And then I use small speculums, and I talk about it in the lecture series, but pop the top off of it. So it's just the bottom of the speculum. You're not like visualizing the cervix. It's really just to kind of be able to apply a little bit of pressure and get your needles internal. So the speculum and then lubricant. And then you do need either 1% lidocaine, 2% with or without epi, and some topical numbing. I use 23/7 tetracaine lidocaine topical from like a compounding pharmacy. We use that for like numbing faces for lasers and other treatments. So yeah, you'll numb externally and then you'll inject with lidocaine externally. But otherwise, I mean, that's really it, which a lot of
clinics already might have, depending on the services that they're offering. Yeah, that's right. It's not a huge kind of, and most of it is not a huge cost.
Exactly. Yes. Right. Yeah. That's why when I look at consumables, I really look at the PRP because the other stuff, is not, not a huge expense.
Yeah. All right. Well, awesome. I see if some people are still watching. So if anyone has questions, please drop them in. Just to kind of quickly go back to this. So again, pretty impactful service to offer. You don't have to have a huge sort of upfront investment other than your centrifuge. Your centrifuge sounds like it's essentially your most expensive upfront investment in order to be able to offer this service.
Yeah. And I will say, honestly, too, what I've seen lately, because I've tried to help some people bring centrifuges in, is a lot of the companies now they'll kind of give you the centrifuge and you order maybe 20 collection kits or, so there's that kind of stuff. There's that kind of stuff too. So yes.
So there's options. It's not a huge sort of upfront investment to start offering the service necessarily from a financial perspective, the profit margin is likely significant. Of course, with no guarantees. And then the workshop, so going back to the workshop, so the workshop is a 3-part series. Shanna is our lecturer. The first lecture is live. So the lectures are pre-recorded. So the first one is live, but you can still register. I would say registration is best accomplished within a few days of our first live Q&A with Shanna. So the first live Q&A is on February 15th. So honestly, you can register probably right up to that. If you plan to also watch the 2 lectures, I definitely would say you should watch this week's lecture and next week's lecture prior to the Q&A, so that you can make the most of that time with Shanna. But again, totally fine to register anytime sort of up until the 15th, I would say. If anybody has questions, if you're in the Nursepreneurs community, you can always tag me. I'm going to put my name, like my Facebook name, in the comments so that you guys know who you're looking for, but you can always post a question and then just tag me so I can get to you. While I'm putting that in there, Lisa asked, is it a special centrifuge?
It's a great question. No, well, and I know this is just about vaginal rejuvenation, but I think the other thing to keep in mind is there's a lot you can do with PRP. Like if you do microneedling, adding PRP to that, I do a lot of hair, so injections into the scalp. So keep that in mind from an investment standpoint. If you're bringing it in, honestly, the vaginal rejuvenation, like training or being able to do that is probably the most intimidating and kind of involved, but like to do scalp injections, that kind of thing. So keep that in mind, because you could use the centrifuge and PRP for other services as well. There's a lot of centrifuges devices out there. So no, honestly, if you can get highly concentrated PRP from a device, you could use it to
That's what you
do
need.
vaginal rejuvenation. Yeah.
So your centrifuge just needs to be able to get highly concentrated PRP when it spins down.
Yep.
Cool. And right. And then, to a certain extent, your sort of the skills you need to come armed with are phlebotomy, right? Or you need to have somebody who can draw blood pretty well.
Exactly.
And most of us, I think, most of us nurses are probably at least mediocre.
Yeah. And
Hopefully
keep in
better.
mind, I mean, my patients, I feel like we have our protocol. So when we are confirming our appointments, we encourage people to be really well hydrated. And I mean, keep in mind, because, since I still work ICU, I love it because I come in and these patients in the office just have these beautiful veins, these like hoses, some of them. So that for the most part, gosh, I was going to say something else about the, centrifuge. It'll come to me. But yeah, being able to draw the blood. Oh, I noticed.
And then, go ahead.
I'm sorry, Casey. Also, like when you do go to bring a device in, talk to your rep about like somebody who could come in or if they have any connections with someone that does this treatment already. Like that's how I went and did the CMA, OSHOT training. But then how I really got good or kind of additional training was my rep for my centrifuge. She had somebody come in and like kind of help reiterate the hands-on like portion of it. So utilize your reps as well. Yeah.
Awesome. Yeah. Lisa said she is going to do this. She's super excited. Honestly,
awesome.
it is amazing. And I love that you made that good point. Like this is kind of a door, right? If you're not already doing PRP for
100%.
other things, this could be the door. And then it's like you said, you can kind of expand, and PRP has a lot of applications. And I will say what Shanna was saying about PRP sort of it's a growing sort of data,
the projected market growth is
base.
Yes.
Yeah. The research, people are just right. They're interested in things that are just sort of that more holistic, less quote toxic, less chemicals, more natural. And all of those are buzzwords, but they're, you know, they're real too. People are really looking for things like that.
Yeah. PRP
At
is huge in
at
other
the same time that they're loving their Botox.
Yes.
Like you said, it's a little bit of a like, wait, what?
It's a balance.
Yeah, it's a balance. It's all about balance, everybody, and that we are all fine with balance.
Yes.
But anyway, it's growing in sort of in the medical world in terms of our recognition of what it can be used for and how it can be applied. So it's a wide open sort of landscape to start implementing PRP-based services, not just vaginal rejuvenation, but we're starting with vaginal rejuvenation because we just are, because we love vaginas, because we're women, we love vaginas. Let's say vagina as many times as we can, guys, because it'll help you get more comfortable, because no matter what, we can't help but sometimes giggle when we use these words, no matter how old we are and how mature we are. I will say that to end with a little bit of humor, what you were saying about it not, you know, kind of being taboo. Even when I was writing the email series to let people know about the workshop, I was like, okay, what?
You were blushing?
I was blushing, and I kept being like, I don't know how many times I can have like vagina in a subject line before Google starts sending us to spam. You know, before Gmail starts sending us to spam. So I'm like, you know, I was thinking of all these different ways to talk about like the sensitive region, the intimate region, because I was afraid we were just going to go to spam every time.
I love it. Yes. My husband says that he calls this the Lord's work. So yes, no, I think it's healthy to have, I mean, we're nurses. We have senses of humor. It's a coping mechanism. Yes. So, and honestly, I mean, patients appreciate, a little bit of
part
a
of
icebreaker.
Yeah. And 100%. And you know what? It is a big deal. Like I think probably in the long run, refreshing for patients to be able to have somebody to go to for this type of concern, because it is still a little bit taboo, and it is getting better. And especially, you know, we have more and more sort of interesting like influencer who are, you know, sex therapists who are like putting, you know, talking about sex and intimacy and all of those things on cue. My 6-year-old just came in when I'm using all these words.
I can hear mine upstairs.
But it's a big deal for this to be a service that women can seek for all of the reasons, including sexual health, but also for incontinence and, like you said, vaginal dryness and all these things. So I love that nurses can be sort of driving that revolution.
Yes.
So, all right, everybody, if anyone has any other questions and you didn't get to drop them here, I put the link to register, but if you need to ask anything else, find me on the Facebook group in Nursepreneurs Community. And you can ask me if you have things you need Shanna to answer, just let me know and I can reach out to her. So
absolutely.
Thank you, Shanna, for coming today.
Thank you for having me. Thank you, everyone.
All right. Bye, everybody. Bye, Lisa. Thanks for coming, Lisa.
Bye.
She's the best. She's always on.